Thanks for joining us on Community Connection. Always a pleasure when you make us part of your weekend. I'm Bill Davis, your host here on Community Connections. Lovely to welcome back a good friend of mine, Marsha and Bill, VibrantUSA. She's been with them since 2005, and I don't know. You up to date on the latest Medicare?
I think I am. I'm getting there.
Okay. I know because AEP is coming up around the corner. What have you been up to?
Well, we have been gearing up for AEP, what they call the Medicare Annual Election Period. That's our focus.
Does that start pretty soon? When does it start?
Yeah, the enrollment season runs from October 15th to December 7th. Any changes that you make during that time will be effective January 1st. However, the Medicare plan benefits for 2023 became available today.
Okay.
And we encourage everyone to do a yearly review, even if it's a simple phone call to find out how your plan differs from this year to the next. For folks on a Medicare Part D drug plan or a Medicare Advantage plan, by now they should have received an annual notice of changes from their insurance carrier that details their plan changes for 2023. And if they want to stay on their current plans, they do not have to do anything, as the plan will simply roll over to next year.
Well, it seems like every year Medicare makes changes to the coverage on these plans. Are there some significant ones we probably should be aware of or know about?
Yeah, you're absolutely correct, Bill. Certainly this year is no different. First, you will notice Medicare is making a huge push for transparency. Folks should have or will soon receive the new 2023 Medicare and You booklet in the mail.
I got that. I got it just a few days ago.
Awesome. Well, yeah, I'm glad they're arriving.
Yeah.
If they have not received it yet, it's available to view and download on Medicare.gov, as well as you can order a hard copy if you don't have one. The first thing I noticed is the more descriptive verbiage Medicare is using to explain their benefits. They are continuing to cover telemedicine, and in fact, it's mentioned several times throughout the book. So I think they're pushing telemedicine.
Yeah.
Also, they give you the website to look up things like medical expenses, such as outpatient hospital procedures and emergency room visits, so you can have an idea of the cost before you get the service or procedure done.
Well, I'd assume transparency is a good thing, right?
Yep.
And what about Part D? What about RX, drug plans?
Yes. So whether you are on a standalone drug plan or have it bundled with your Medicare Advantage plan, sometimes the changes are hard to decipher. Like it is obvious, Medicare is raising the standard annual deductible this year to $505 because it states it in black and white. But many of the plans will have lower or no deductibles, but they can't be higher than that $505 set by Medicare. Other changes will not be so obvious until the individual starts looking specifically at their prescriptions on these plans. Copays can be changed, drugs can be added or removed from the plan's formulary, etc. Medicare is continuing the senior savings model, which, if your Part D drug plan participates, sets a limit of $35 monthly copay on many insulins prescribed for diabetes. Many of the plans will now be covering some vaccines like the shingle shot at a reduced or no copay for 2023. And then pain management is a huge focus on Medicare to reduce the abuse of pain medications like opioids. The Medicare and You booklet is an invaluable tool to understand these Medicare benefits.
She is Marsha and Bill, VibrantUSA, unconfusing me when it comes to Medicare, Medicare Advantage, RX plans, supplements, things like that. Any other changes you might want to talk about?
Well, Medicare not only changes benefits, but they also make compliance changes with affects how the agents and organizations must work with Medicare beneficiaries. And one of those changes this year is Medicare now requires all conversations between a licensed agent be recorded. So yes, your calls about Medicare are required to be recorded by each agent and organization. Recently, the Centers for Medicare and Medicaid Services, CMS, defined all agents, insurance agents, and third-party marketing organizations. This means that as of October 1st, every Medicare agent will have to follow the same standardized regulations. And the new rule is mandatory and applies to all Medicare calls. So if your listeners are not comfortable being recorded, they should plan to meet with an agent in person.
Obviously so. Now, you mentioned Medicare a few minutes ago. Let's say you're not eligible for Medicare yet. Maybe you're not on it. You're on an individual plan, a work plan, something like that. Anything they need to know about?
Yeah, so those who are on individual plans, the annual election period for individual plans this year is going to be November 1st and runs till January 15th, 2023. It's a little bit longer. However, I highly recommend everyone review their coverage and make any changes prior to December 15th to be sure they are on their desired plan for January 1st. If you wait longer, your individual plan may not start until February 2023, and this nullifies any out-of-pocket cost you may spend in January under your old plan.
I think I know the answer to this question, but sounds like we all ought to be reviewing our options, right?
Yeah, I highly recommend everybody on Medicare and drug coverage, either through a standalone Part D drug plan or bundled drug coverage through a Medicare Advantage plan, review their 2023 plan options so they can change, if needed, to a plan with the fullest coverage for their medications.
Anything else we ought to talk about as this fall season comes upon us?
Yeah, I would recommend everyone on Medicare or individual carefully review their 2023 notice of changes from their current carrier, and if they want to keep their current coverage, it will normally automatically roll over. However, if they decide they want to do a review, call an agent early to get on their schedule, as most agents become harder to reach the deeper we get into the season.
There's about a bajillion other agencies I know doing the same things that you guys do. I'm going to give you the floor and say, Marsha Neal, why should they pick Vibrant USA?
Well, great question. Vibrant USA for the last 19 years has dedicated our services to helping folks on Medicare, young or old, navigate the confusing world of Medicare insurance. Our agents contract and certify with most of the carriers throughout Washington state, and they have to be educated on all of their available plans in order to represent their products. Our agents strive to find the coverage that best fits our clients' needs, taking into consideration any medications they're taking, along with medical providers they see and other important information such as travel or cost considerations. There is never a fee for our service, so folks should just give us a call and let us help them out.
We'll give them that number here in just a moment. The Medicare 101 seminars, you still doing those?
We are. We're offering educational online webinars twice a month, one at 10 a.m. and one at 5:30. And these webinars are a great way to learn the basics of Medicare and 2023 changes Medicare is making. We also post informational videos on the basics of Medicare on our website at VibrantUSA.com. To find out the dates these webinars are being held or to visit with one of our agents in person, by phone, or video chat, call us directly. And our number is 866-733-5111. You can visit our website or you can find us on Facebook.
Can you do me a favor? Can you come back next month in your least part of your busy season? Yeah, it's going to be busy next month.
It's been crazy, yeah.
Yeah, can you come back during open enrollment and unconfuse us some more?
I will do that for you, Bill.
Okay. Marsha Neal, Vibrant USA on Community Connection. We'll continue with the big show here in just a moment on KGMI.